Thanks for joining us, everyone. Good afternoon. My name is Kelly Caseman. I'm the Executive Director of Think Kids, and I'm happy to welcome you to Session 1 of the 2022 Regional Health and Hunger Summit Series. This is a virtual series as part of a larger project where we take a closer look at connections between the healthcare system and community resources that address hunger. For this series, again, this year, we're focusing primarily on 3 counties in our state: Boone, Lincoln, and Logan. Health and hunger are profoundly connected. Their systems should be too. You can find more information on our website, thinkkidswv.org, and on Think Kids' Facebook page. And we hope you'll help join us the discussion, because more than ever in this moment, we need to unite in our efforts to ensure all West Virginians are as healthy as they can be with access to healthcare and nutritious food. There are a lot of challenges to this, but I've met some great people in these counties who are leading efforts to build these bridges. And so we're glad you're here with us to meet them and join the conversation. Let's get started. You'll have the opportunity to share your thoughts and ask questions. Go ahead and type them in the Q&A while they're fresh in your mind if you'd like. And with that, let's get underway by thanking our main sponsor for the event series, the Palatine Foundation of Huntington, for their generous financial support again this year for the project. If you are a nonprofit that serves the Foundation's West Virginia service region and have a mission to advance transformative health initiatives, we suggest you visit their website to learn more about their important work and grant opportunities. We appreciate the opportunity to work with them and their support for work like this. Here's a quick agenda for today's session. We'll introduce our panelists and then dive into the discussion. Please keep any questions or comments you have coming. If we don't get to them during the discussion, we'll have time set aside to ensure we get to them. And with that, let's begin by taking a brief look at 3 counties where we'll be centering today's conversation about the challenges faced in rural West Virginia in keeping their populations healthy. According to the U.S. Census in 2021, Boone County had a population estimate of around 21,897 residents. Most of them were white, with fewer than 1% Black or multiracial. The median household income in 2020 was $45,297. The median household income, according to the U.S. Census, was $67,521 in 2020 in the United States. The U.S. poverty rate in 2020 was 11.4%, up a percentage point from the last year, but in Boone County, the poverty rate was 17.8%. Similar in population demographics is Lincoln County, with 20,617 residents in 2021, about 1,000 fewer residents than Boone County. Its population is mostly white, with a slightly smaller Black population and a slightly larger multiracial population. The median household income in 2020 was $42,064, and 20.6% of residents lived in poverty. The third of the 3 is Logan County. It had over 10,000 more residents than Lincoln in 2021, with 31,909. It's a little more racially diverse, with nearly 96% of its population white, nearly 2% Black, and 1% multiracial. In 2020, the median household income was less than the other 2 counties at $1,250 a year. And they also had a slightly higher poverty rate at 22.3%. This is twice the national poverty rate in 2020 than the U.S. average at 11.4. And so with all that context and background information, let's begin the conversation by introducing our panelists. I'm going to share a brief introduction of each, and then we'll tell you, and they'll tell you more about themselves and the work they do as the conversation unfolds. We'll go in alphabetical order. So Chad couldn't join us today. He's the director of Hungry Lamb's Food Initiative. He may be joining us for another session down the road. Kristen Dial is the executive director of Coalfield Health Center, which serves more than 3,000 residents in Logan, Boone, Lincoln, Mingo, and Wayne counties. She's also a founding member of the Wild, Wonderful, and Healthy Logan County Initiative, which is a collaboration of entities implementing a community health plan to create a healthy workforce and increase economic development. Karen Odell is the Communications and Leadership Development Strategist with Southern West Virginia Health System, which is a network of community-based rural health centers, including school-based health centers and pharmacies serving Lincoln, Logan, Kanawha, Mingo, and Boone counties. And then Michael Tierney, who is the Executive Director of Step by Step West Virginia, a regional community education and leadership organization with a focus on children and family programs serving communities. Welcome, everyone. So let's jump into question 1. How would you describe your organization's relationship with similar service providers in your community? For example, with other healthcare providers or healthcare organizations, if you're a healthcare provider, or with other community health support systems, if that's the work you do. What does that look like, and how do you collaborate?
Want us to jump in? Okay, so I'll go first then. So prior to 2018, we worked very independently, but when we did adopt the Center for Rural Health Development strategy on Wild, Wonderful, and Healthy Living County, based off of Wild, Wonderful, and Healthy West Virginia. So I feel like the introduction that when we all met at the regional meeting, and we were working together in our communities, but the model really gave us a way to, or a structure and a vehicle to start to begin those collaborations. So our collaborations did begin in 2018, and we brought together the core team of Wild, Wonderful, and Healthy Living County, which our core team consists of Coalfield Health Center, which is a federally qualified health center, our local hospital, which is a kind of our anchor organization, Logan Regional Medical Center. And we also have Pride Community Services, which is our community service action organization, in addition to our FRN and a few more in our core team. But we have been meeting regularly, bi-monthly, since the fall of 2018 to work on our community health improvement planning. And we really enjoy the time together. So our collaborations really have just continued over the last few years to just grow stronger as we work on community health improvement.
Well, thanks, Kristen.
I can go next. So as a federally qualified healthcare system, collaborative partnerships are very important to us. Would I say that I've been with the organization about 3 years, and I have seen growth in some of those relationships through both the COVID-19 pandemic, whether it was through testing vehicles, being involved with health departments to assist with not only the testing, but also the tracking and the information and the data, but also the vaccination programs. I think that was one of the success stories that I could share from ways in which we were able to develop new partnerships. We may have always had some activity, but that was really one of the opportunities that we had to not just have a person involved, but really groups of people involved. We cover at this time 6 different counties. And in some counties, we're a little bit more anchored in terms of collaborative partnerships than we are in others. And while our intent is to find new ways of working within partnerships to the betterment of our communities, both health and wellness, I'll be the first to say at times it's a matter of getting in front of the right person or what makes sense. We have a variety of people who work, whether it's from quality perspectives, whether it's care coordination perspectives. We, of course, have our providers and our nurses and our front office. But at times, we have a tendency to be spread a little thin. And so I would say that one of the things that we could do better is identifying where we might be able to build strength in partnerships, but also finding the right person within our organization to do so.
Right. You know, Karen, just to piggyback on that for a minute, you know, my background is really working with healthcare. And I've always found that, you know, the participation we have from healthcare really comes from the top down. So sometimes they want to keep their providers in clinic. You know, that is really important for a variety of reasons, especially if you don't have enough providers, because we have a workforce issue, to see their patients, for them to kind of leave the clinic setting to go to a community meeting sometimes can be really difficult. And so kind of breaking that silo, because, you know, trying to recontextualize what healthcare means from that community's perspective, like to see Kristen and their organization really kind of buy into that is critical. And some organizations, I know that your organization does it, but some really just don't kind of see the benefit in doing it, right?
It's difficult. So you have absolutely your front line, right, is what you're there for the community to be providing. And there's a shortage of individuals, just in rural healthcare in general. The desire is there. I've seen it in our provider level. I've seen it in our nurse practitioner and our PAs who work in our school-based health systems. There is always a desire. The issue becomes sometimes you are set to go to that meeting and then something happens in the day, right? So you may have established who would take care of something from 1 to 2, but then something came in at noon that absolutely had to take precedence, and you kind of miss that opportunity. And then once you've missed that opportunity a few times, that opportunity can shut down. So I think that it's invaluable to be able to identify administrative level individuals who might have a little bit more flexibility, but then have that commitment to bring it back down into the healthcare setting and the provider level.
Well, I'm Michael, and I'm in the hallway not because I'm being punished, but because even in Charleston, where my administrative office is, I'm getting as close to the router as I can, which is the hallway that leads to my office, because everything was kind of crackly before that. I direct step by step. I started as a writing group of kids in foster care in 1988, and it's evolved into a regional, particularly Lincoln, Logan, and Kanawha counties community education leadership program. So, and their mothership has been the Big Ugly Community Center on Big Ugly Creek, which is over the ridge, Logan County. 2 miles of the creek road is Boone County, which means we were at the end of all 3 lots of service, never got that is the road repairs. So then in Charleston, we kind of we set up administrative office, kind of financial staff, et cetera. But we asked around, so, who's being and housing developed now. More recently, we've established on both the west side and the east end. But when you're in a community that is known for not having a lot of local resources, community being very, people float for 2 or 3 years, and we're going to do some up as soon as they're 6 months or your number. So we, by necessity, had to invent things ourselves a lot. Go an hour to the county seat and knock on the door saying, hey, this is supposed to be a county-wide resource. How can we get it down to the southern part of the county? But it's not just rural. Charleston is a great example. If you live in a housing development in Charleston, with all of the agencies, the resources can be as inaccessible as they are on Big Ugly Creek or up Buffalo Creek in Logan County. I think the best, and I would refer to us by necessity, we've collaborated a lot with health organizations because in particular, until the advent of school-based clinics, there was not a lot of local health providers. So, we just had a family night at Big Ugly a while back, and we had somebody in because of a relationship with health, right? COVID had somebody in there both giving vaccinations and COVID testing. We had somebody else coming in training people on how to use Narcan, because that's a huge, huge issue. We are 66% of the kids in our mentoring program do not live with their biological parents, largely because of the opioid epidemic. So I find people are wonderful about coming to you for those kinds of events. My dream and fantasy is that they'll recognize that places like after school programs or even schools are places there ought to be therapists. And one of our huge shortages is good access to healthcare. Within food security stuff, WV Extension is the most wonderful. I mean, it varies from county to county, but overall, they are the most consistent collaborators. They'll do cooking classes, they'll do gardening, food preservation. But we've, at all of our sites, whether urban or rural, when a need comes up in the community, we scan around to see who's doing something. Sometimes it's as far away as Berea College that who collaborate with to have a gardening program in both Lincoln and Logan. And then sometimes it's people just down the block. Our primary collaborators, and just one really good example within our own, I would say our system that we're involved with is community education. Logan County Schools is I have the best collaborative relationship I've had since I worked at a school in Boston in the 1980s. They are phenomenal. And we have started at our request, but they met that request and more. We have a monthly meeting at every middle school and every high school, and the principal, the counselor, the appropriate social worker, our after school director, our AmeriCorps that are doing mentoring projects, our county director for Logan County, and other people rotating in and out. We meet on a monthly to what are the particular needs of particular kids and families. And I find that is something people get pretty jazzed at going to. And, everything from finding out a kid hadn't come to school for 2 weeks because he was embarrassed because he couldn't afford a haircut and felt goofy, to, and our after school director saying, I'll volunteer at every after school program once a month. And because evidently that's not an uncommon problem. Or another case, we found out that had the attendant officer who manages the McKinney grant went out and got him a bunch of clothes. And I had a neighbor that I knew had an extra bed. And I asked if they would be willing to pass it on, and I took it over to his house. So that kind of getting together to problem solve locally enough about particular families has been the most powerful kind of collaboration I've been part of.
Thanks, Michael. I appreciate that. It's a good segue into the next question, because you mentioned your relationships with the Department of Education. And so my next question is, how would you describe your relationships with other providers of other systems in your community? So do you feel as if you're well connected, if you're a medical provider, with community resources? Are you well connected with the Department of Education? And does that change from county to county, like Michael was saying? Some counties, great relationships, some counties, there's no relationship.
So I'll speak, as I said, I'm really speaking on behalf of the core committee of Wild, Wonderful, and Healthy Living County as their representative, because we have been in the trenches together for the last years. But as I said, we meet bi-monthly as a core team, but it is our goal to have a quarterly team meeting with our Community Health Improvement Committee. And our Community Health Improvement Committee is largely non-healthcare business leaders, the local Board of Education, and what we consider all cross-sector collaboration, because as the model kind of teaches us that we're trying to move the needle in healthcare, but we only have these patients in our four walls for 20 minutes per quarter. And they're in the community and they're living and they're working. And we understand to move the needle in healthcare, we're going to have to work with non-healthcare entities. So our community health improvement has been really valuable. In Logan County specifically, the Board of Education always has a representative there, civic organizations, and really everyone brings so much to the table. To know that we're all working towards one large mission has been very helpful. And I feel like it's going to really take that. In Logan County specifically, I know the county health rankings just came out, health rankings from the Robert Wood Johnson Foundation. And unfortunately, Logan County is 54 of 55 counties, only to be followed by McDowell. So to be at the bottom of the nation and the bottom of the state, is, it's going to take a heavy lift for the entire community. So at these community health improvement meetings, we're always selling that fact of, we need everyone on board to help improve the health in Logan.
That's great. I wish I could remember the statistic of, the gist is that healthcare really doesn't just happen within those clinic walls. It happens within the community. And so I think that what you all are doing is phenomenal. And I'll put, when we post this on YouTube, connections to where these other wild, wonderful, and healthy projects are happening. I know there's one in the West Side. I can't remember where the others are, but it seems like a great collaboration.
That's wonderful. I would say from our organization standpoint, we have some very great opportunities within the school settings that we're in. So we have some principals who are very forthcoming with us and look for opportunities that we can assist inside of the schools that they're in. Would I say that we could probably do a better job, or there would be potential opportunity for us to learn more about the opportunities within counties where we may not have a physical presence? I would say that the answer to that would be yes. We support our youth in a variety of ways in terms of, whether it's a sponsorship of teams or sponsorship of the arts programs, and bundling opportunities to support the health and wellness of the youth in our areas through that type of situation. Absolutely. But when it comes to, would I know as much as what might be happening at Mingo Central as I do at Logan High School? I would say I don't.
I just want to say this before Michael talks from his perspective. I've worked with your organization for a number of years when I worked with school-based health centers. And one of the things that I really learned in that relationship was that once a medical provider creates a relationship with a child and then the family, there's such a trust there that if that provider says something like, your child should go to fit camp in the summer and create, get to know some folks, that really went a long way to, getting that child out and more engaged. And it was so important. And so I think that that's a real connection there, that if, I know it's hard for people to get out of their those clinic walls, but once the community recognizes the trust that the healthcare professionals create with those families, it becomes a really important partnership to then refer them to meaningful programs in the community.
Absolutely. Absolutely. Fit Camp has been, you may be familiar with Renee. She is the champion of the Fit Camp. She's one of our school-based health providers. And I have an opportunity every once in a while to go to the schools in terms of like an open house. And I am always amazed at how the kids interact. And so I would agree with you 100%. There is a lot of trust factor there. Our concern at times is for the children who may not utilize our services in that particular format, how do we break down some of that communication barrier so that more children are involved? And so it's a two-pronged process. Absolutely.
Into Chris, because Karen and I were just talking. I'm very jazzed, obviously, about it because it's kind of an unprecedented access to really problem solving by kids. Now, it's not practical for a physician to come to every one of those meetings. We need our physicians and our therapists in particular having every minute they can with kids. But what if once a school year, we ask them as a guest for 45 minutes to let us know what they're hearing as the patterns they're seeing among the families, or us going to them. I mean, we just got 3 family support center grants. We got this 2-year goodie that every county is going to have a family support center grant because of federal money. And, so we'll have some additional staffing to do some of this kind of interagency work. But I'm a big fan of, short, focused, how can we problem solve about this particular community need? Not going to take a whole lot more. Us with them. And then the other are family, the start Lincoln's Family Resource Network starting 26. And one of the challenges we have in a very rural county is that what goes on in Hamlin versus what goes on in Harts and Big Ugly are very different issues. in Logan County, Man and Logan and Chapmanville all have very distinct identities. And I think a countywide body needs to rotate their meetings. And it's hard because frequently most of the agencies are in a particular thing and it adds travel time. But the expectation that it's always going to be the people in the most rural communities that are going to have to travel the hour to be able to have these interagency dialogues. You know, what we've done on Big Ugly and Hearts is every 3 or 4 years, I'll help get a coalition going someplace. We meet in Hamlin because no one else will come down to Hearts. And then after 3 or 4 years, I'll go, I think I should be spending this time inviting people in like Marshall Autism Services who are awesome and will go any place in the region. I think I should spend my time, you know, collaborate with people that'll actually come to my community. So if there was one thing I would evangelize on is if somebody says that they want to serve a county, they've got to rotate how they get around with the counties, even if it's just once a year. It makes so much of a difference. The trust factor. If I invite someone to a community family night and they see somebody, they are so much more likely to go up for services someplace in Hamlin or Danville or Logan if they've actually seen this somebody from that agency has felt it worthwhile to come out in the sticks to visit with them.
That's a great point. And it's also, again, Michael, a good segue into the next question. During the last summit series, a prevailing theme was often we do not know what's going on in other organizations because we can be very siloed in our work. So it could be because of systems, or it could be because we're located in a more rural place in a county where people don't come. Do you agree that that's a continuing challenge?
So I know Chad Eckers was supposed to be on today from Hungry Lambs, but he couldn't make it. So I was going to tag this question into Chad actually, because when we started our collaboration with Wild and Wonderful, one of food insecurity was at the top of our list of issues we needed to tackle. So we began to explore, you know, the existing resources in the community. And we all thought we were experts on Logan County. We're very entrenched in the community. And as Michael said, you know, geographical Man and Chapmanville may not see what Logan is seeing. But to much of our surprise, as we started to investigate food insecurity, you know, we came across the path of Chad Eckers and Hungry Lambs. And we were amazed about what we didn't know about our own community and really tapping into the existing resources. So I think as our organization has matured over the last 2 years, that is kind of an underlying premise of really, you know, find those existing resources and tap into those. And now we're beginning to develop those relationships where we can really leverage our resources together. And that has been really key for us.
Mm-hmm. That's a great point. You know, I work on another project where we were doing focus groups a couple of years ago. And during the same day, we would have somebody come in and say, there's nothing going on in our community. Nothing is happening. These kids don't have any services. And then a few hours later, we'd have someone say, we got this great grant and nobody came. But, you know, somewhere that's where the problem lies, right? It's where, how do we get the word out about a great program and make sure that people are accessing it so that organization keeps their money, keeps that good program going?
I would say that we will, to a degree, maybe always have some silo, just from the expanse of some of our areas and the pockets of differentiation that Michael was talking about a little bit. I agree in we need to find ways to reach in to areas versus a centralized place where they could come to. At times, what I think that we as a society miss is the true barrier to transportation to get to where the resource is. And we watch it in our consumer behaviors, right? So COVID changed the way we even interacted in our personal lives with the grocery store. And now there's an opportunity for, you can order it ahead and pick it up, or you can have it sent to your house, or you can have Uber bring it to you. And those are models that you watch if you have the opportunity to utilize them. But when you get into your rural areas, it could be a matter of, I'd love to take advantage of that resource, but I have to lean on somebody to either get me there, or there's so much paperwork I have to gather in order to get to where I can utilize it. And there is a sense of self-defeat sometimes. I think when you go into some of these pockets where you know that good help could be there, but you've got to somehow lift them up to see it might not be what it was 15 years ago when it was really difficult.
That's a good point. Thanks, Karen.
I know we're going to talk a little bit about how the pandemic affected this, but my example immediately comes up with that. I think the silos really broke down in a really moving way during the pandemic, because you would see people trying to problem solve, particularly about getting food to people, because it varied so much from community to community, county to county. And you would find that, so the church food banks and little problems, transportation, little problem solving things. We need more funders that say, we love gas cards, because we had really isolated communities that were not going to, where people with lousy cars were not going to make it way into the middle schools that were off in the distribution centers for food where people could come pick up. But we gave gas cards out to people who were kind of like neighborhood team captains, and they would pick up the food for other people. I mean, we worked out the trust system in Logan County, and it was not, nobody was taking food and selling it someplace. So kind of working on those kind of barriers and figuring out creatively how people can overcome that. Because, I've been hearing transportation ever since West Virginia in '78, and it's a real issue, and it's gotten even worse again because of gas prices and how expensive used cars have gotten. People are used to rolling through crappy used cars, die, and then they get another one. Well, those used car and their parts are real. Now people are stealing catalytic converters out of cars if they're isolated. It's bizarre stuff. I do think, and the other thing is, as much as we're zoomed out, I think Zoom, I mean, I kind of, two other things with how to break down the silos. One is, I think it would be great to have an annual Zoom meeting of people who don't necessarily have the time to get to the FRN meetings or the advisory group or that project, just so we are faces to each other. Because what I definitely find is, I don't give people 211. I mean, I say it's a resource you can call, but I don't refer someone to an agency unless I know a real person they can try and talk to, because people find it really alienating if they don't have great phone skills to begin with, and they don't find somebody who's really good at immediately listening and helping them figure out how they can access this resource. So, I think if we in each county had, a Zoom fest where, these are our frontline staff, this is so and so, this is what their roles are. People want to name if they're actually going to try and make an appointment to go someplace. And then, so there was that. And then the other thing is, go where no matter, people show up to midget league and little league and t-ball, and they show up to, I was at Logan High School for the arts festival. Between the band and the choir and the kids who worked this great visual arts, there were 261 people in Logan High School that came to an event. And I loved it. The event was great, but I thought, oh man, what if we had a booth, the COVID tests and shots? That event was actually, Tammy Bowling, our Big Ugly Community Center director, was named a hometown hero, and they gave her a $2,500 check to do what she wanted to in her community. So Tammy thought, if I've got, people, she knows people like her, she knows people would show up to celebrate that. So she called and got the COVID folks and got the Narcan folks, because they might not come out for a meeting about how to deal with Narcan, but they were going to come. So figuring on things that people go, people if performing kids are on.
Shoot. Michael, I missed probably about the last half minute of what you said. Could you try and say it again without your video on? Maybe that will help.
Okay. I actually have in big sometimes. going to that people are showing up. And I gave as an example that there was a arts celebration, choir, band, end of the year celebration at Logan High School. They got two out there. And all I could think of is, oh, do I wish we had some health providers here. And the example I'd given earlier about Big Ugly having a Narcan instructor and having COVID testing and COVID means available, that was actually somebody being a hometown hero. We knew it would come out for that. And the hometown hero said, let's do COVID vaccines while we're at it. So that trying to figure out what are the community events, because people do find the gas money to go to all, and those are the kinds of, we're going to meet families and let them know.
I agree. Thank you, Michael. So we've already kind of segued into the next question about whether the pandemic made collaboration harder or easier. In some ways, it really did kind of change the way we look at collaboration. I know for my organization, it's hard for me now as we transition back to whatever we want to call the new normal, but it's hard for me now when we plan things. For me, now I'm mindful of the fact that transportation is a real challenge for people. And why would I schedule something in the community knowing that people can't afford it, or they're not going to be able to get out, or they don't have a job that they can get away from, when I could try and do it virtually and have more people engaged? Karen or Kristen, have you found that COVID broke down some barriers or created new ones?
We actually found both. Because working through vaccinations, our bonds really strengthened, specifically with Karen's organization, Southern West Virginia Community and Health Systems. I'm working with Courtney Reynolds there and the Logan County Health Department. Those bonds were extremely strong for over a year working together in those regional vaccine clinics. But coming back to like the food insecurities and some of our other initiatives, we had our community health improvement meetings, and we had all the momentum of those in-person meetings. And then all of a sudden we had to go to Zoom, and we just didn't feel like the engagement was there as much over Zoom. And we actually just had our first in live, back in person community health improvement meeting. And we had about 25 or 30 participants, and it was just nice to be back together again.
Right.
I would agree. So throughout the course of the pandemic, it allowed for some more time, I think, to be spent with collaborative relationships twofold. One is you weren't in your pre-world of COVID where you were trying to get from point A, B, C, and D. And you may have had more time within that 8-hour period to actually involve yourself with other people and organizations. Then you come into an environment where through herd immunity improvement and vaccinations, and you're coming back now to where you can be more in person. I find that the engagement when you're on Zoom, if somebody doesn't have their camera on, they may be multitasking to a degree that then you're not getting the accomplishment of the meeting as you once were when all meetings were kind of forced into the Zoom environment. So I think all of us are going to have a transition period of finding the hybrid model. And maybe it's that once a year in person and maybe once a quarter on Zoom, but specific agenda items, because we're back to a world where we're trying to do 20 things and maybe not doing 10 things great.
The one thing that I would add is also people were zoomed out. And if you've got crummy internet, like I do today and sometimes do in Lincoln and Logan counties, Zoom can be challenging. Facebook live streaming and Facebook communication in our counties is the way to go. And I'll give 2 quick examples. For Appalachia, we're supposed to have 6 face-to-face or mask-to-mask workshops around growing healthy vegetables and preserving them and healthy heart cooking and stuff. And we couldn't do that, but we would do a little bit of a live stream of something. And then people really got in, and we had a closed group for each of the counties. And people really got into sharing. I mean, there was these wonderful photos of everything they'd picked from their garden that day, covering their counter. And I can easily imagine doing the same thing with healthy cooking. We just wrote into our family support grant, having 8 workshops where we cook something healthy and show people how to do it. And then they get the ingredients to take home, the old supper in a sack model. But I'd be willing to bet people will post what those dishes look like on their tables or on their counter. And when in doubt, give them a raffle ticket every time they do that. And then you make the sharing information fun and hitting people in our comfort zones. And at least in Lincoln and Logan County, Facebook is the way to go. Even as people complained about all the online stuff, we saw a great increase in people sharing tips back and forth with each other. I think that's transferable to things in addition to food security.
It's great. Thank you, Michael. That's something for me to remember for session 3 when we talk about transportation issues, because that seems like a great way to build community as well. Next question. At any given time, do you feel as if you have everyone on staff who knows when events like these are scheduled by community partners, health fairs, farmers markets, mobile pantries, and community events like picnics or back to school events? So do you and your staff know when these are going on in your county?
I think that's a real challenge for any one person to know, because, we rely on our social worker a little bit because they're out in the community and they know where to tap in those resources. The staff tends to rely on me a little, but just because I'm, involved in the wild and wonderful, and because, we are entrenched with those community leaders and kind of what's going on. But that's one of our main goals, as Michael said, social media. I feel like, where is people getting their information? And I know a large portion is getting that from social media. So one of the initiatives with Wild and Wonderful is we did create a Facebook page. We have not went over to Instagram or any other social media platforms to date, but our Facebook is very successful conduit of information. And, we want to be that spot. That is the spot where you find out anything and everything that is dealing with health, food, and that platform, where people will know to go there and share that information within the community. So we're still trying to evolve, but that is one of our main goals.
And you feel as if it's helped to date? It's kind of evolved into more of a right.
Yeah, it's not just events, but we also want it to be a conduit of just educational information, anything revolving around health.
Great. It's a good idea. Karen, you have anything to?
I would say that, so if we are the creators of it, I feel like we do a better job of getting the information out sometimes than we do of receiving information to a central location within our organization. But that doesn't necessarily mean that our staff in some way either doesn't know about it or isn't participating in it. And at times I can be a little shocked just at the things that we're not communicating internally. And I think that shows the challenge of being in a larger setting. And an instance that I'll give is we had there was a community baby shower that Hamlin does. And we were participating in it. And there were a few of us that were participating in it in different ways, and kind of learned the week of that we're all in this together. So then you take that and you amplify it to where lots of things may be going on in the county, but we might not necessarily know in a coordinated environment. So I love the idea that Kristen just talked about, or the example that she just gave, where there's a place where all things kind of go and are uploaded. And I do, to a degree, I think our FRN network attempts to be that conduit. And I have had the opportunity to be on some of the calls where I learned what was going on. But I think maybe there is an opportunity for some type of technology-based place where information could go. The challenge of that, right, is who pulls it up, pulls it down, how does it stay current? And I think that might be an area where as we all continue to grow and evolve and through grants and other opportunities and funding that comes together, to me, that would be a lovely spot, that localized place, but then someone in charge of how the information stays current.
Yeah, that's always been the biggest challenge for us with web pages, et cetera. I have had a wonderful Vista this last couple of years. He created an app to help our mentors report what the information they were getting from mentoring meetings, because nobody had the time to write things down and then type them up later on. And I do wonder about if there is kind of a, it's happening for health and community app that someone could create that people could easily post something to and easily choose about getting notifications. I sign up for a chance to get 15% off on, see music. I sign up for all sorts of things, and I don't care if I get a text. I think people where there's no cell reception, that's an issue. But I think people might sign up to get little texts and notifications if they thought something was going to be worthwhile for them. And so I think that something with Facebook, something with an app that could give people notifications. We're on the verge of knowing how to do it, and the younger people know how to do it, but don't necessarily have access to the content we want to get out. So if there can be some sort of joint thing, I think we could, that would be really helpful, but we're not there yet. And same thing, we got 19 sites, and that somebody in Buffalo Creek knows what's going on the west side of Charleston. We did with the pandemic, we have weekly managers meetings, and then they each have a weekly meeting by Zoom. And now they're getting back in person again. So there is a little bit of a dissemination, but they really were as much peer support groups with how we're getting through how difficult this is. My favorite question that we had that came up was just, how are you going to take care of yourself this weekend? And it just transformed how you felt about being on these calls. And it challenged us to not just burn ourselves out. But I think already we've shifted to doing the meetings things at a time. So trying to maintain a little bit of the slowing down and setting priorities for self-care. People thought more about self-care just because we were trying to keep from getting a disease during the pandemic. And I see people are already slipping back, and that's the first thing to go when we get busy.
A great point. And I think that many of you already answered what we had as the next question about challenges as to knowing when events are happening. And we're going to explore a little bit in a few minutes about this kind of idea of centralizing information. But I want to get to this question first. We can all be territorial in protecting the livelihood of our organizations. Do you think that this kind of protectionism, it plays a part in the breakdown of collaboration between organizations, especially in rural communities?
I think that it definitely can, but I think once you start to build those relationships in our experience, we all understand that, we may be in the business of primary care, and there's plenty of primary care patients to go around with a shortage of physicians. So we're all experiencing the same struggles and challenges in our organizations, but we've really been able to set business model aside and really put community first. We're all community members, and we care more about the health of our community members at large and the mission and vision of our organizations more than we do our business model as far as competition goes. So that's been our experience.
Great. So you would say that, participating in Wild, Wonderful, and Healthy Logan County has helped refocus this kind of collaborative vision for everyone?
I think it just really brought the parties to the table. So you had a third party in the West Virginia Center for Rural Health Development, bringing together the people that need to be at the table. But it got us talking, and then it got us working together, and then it got us relationship building. And now we're all working towards a common goal, as of where, originally we probably would not have sat down at the table together.
Thanks.
I think Kristen has a great point in terms of we have a limited amount of providers for a large number of population. And sometimes it's a matter of us realizing or thinking through the fact that we may have locations that are in pockets that help support what seems like a small circumference of area. But really, when you get into the challenges of how people are accessing that particular location, that's what you're really there for, right? Is to provide opportunities and resources into areas that may not necessarily have either the travel means to get to a larger location, or to provide that care that they would have to then leave their county to go seek if you weren't the ones that were there. I think that if we built better partnerships with individual organizations, like if all of us in healthcare came together and said, okay, you know what, let's do a community-wide event in 2 different locations, one in the summer, one in the fall, or one in the winter, and let's all say, here's what we'll each provide there, so that you're not stepping on, it's not 5 blood pressure checks available at the event, but maybe there is an eye doctor who is there who can, and while we can do certain things, let them take the lead and not worry so much about the patient transfer, because in all reality, some of care is provided through location alone, right? Like, this is the place that I can get to. And some of it has to do with, this is the person that I have had my healthcare with for 20 years and I trust. So you have lots of opportunity. But I think that coordination aspect is what breaks down some of the fear of the business model.
Right. I often feel as if, when looking at the 2 different systems, healthcare on just as a system on a federal and state level can be very competitive. And so it's already bred into the system to that, you have to actually kind of fight against sometimes to make sure that you're collaborating in a meaningful way on the local level. Michael, do you have
the most successful thing I have is how to bake a pie that's big enough for everybody, or how to address where things falling through this. This is a Charleston example, but a few years ago in Holden, and all of a sudden kids in arguably the 2 poorest urban, certainly, but I think they rank up there with McDowell County's poorest community elementary schools in the state. Those kids are suddenly not going to have any after school services. So we pulled together anybody that was interested in trying to figure out how to provide resources that was already doing that. And we divvied up who's in that age group. And luckily, because we were all collaborating, Greater Conduit Foundation said, oh, that's creative. And they gave us money for a stopgap. It was a 1-year stopgap and kind of emergency funding, but they also gave us an award for like playing really nicely with each other. So I think there's way too much to be done, but it can, if everyone's going after the resource individually. But I have found that funders like it when you work together, and might you a wider range of people are collaborating and not competing. And then so that's kind of that we how to keep kids from falling through the cracks. But the other thing is just how any time that there's a larger grant with economy of scale, Big Ugly got into as many different other communities wanting solidarity with other poor communities. But if you were applied to serve kids, nobody was going to give you the grant. But if you work with 2 or 3 other communities and are serving 200 kids, then you have an economy of scale that people will pay attention to. And so I think that's how we developed into a cross-county agency. Most we were looking for models of how other way people did it. People love to have, and this is actually this is my best strategy with the school system. People love to be asked for advice. So if you go in saying, well, how can I learn from what you've done? I hear you did a really good thing here. You build trust, you get the door open, and they don't feel like you're out to get their resources. And they start seeing you as a partner. School systems take a long time to recognize people as partners. Once you've established that, they love it. But it takes a long time, and it takes a long time with a new principal to build that. But if you start by asking advice of, what do you wish we could do for your kids? Then the door opens. So a fair amount of humility and going and not assuming that we know coming in from the outside what needs to be done about this system or that healthcare, and of genuinely curiosity about what the potential partner has to offer. That to me is how you break down the territorialism, and it's genuine. It's not a game. If you're not curious about what someone has to offer, you really should be working with them, because it's fake.
That's a great point. And what I'm hearing as a takeaway is, these wonderful funders who are funding collaborative efforts. That's, really incentivizing some of the great work that we're seeing in communities. I'm going to pivot a little. And I think that you've answered this. So if you want to reiterate what you've said before, if you want to share something new, have you ever in your communities collectively worked as a community to promote or address what is either working, like something that is now a success, or you've identified something that is a disparity and that you are trying to work on?
So one specific project in Logan County we identified, of course, was the availability of really fresh fruits and vegetables, specifically analyzing the data and of course, Chad couldn't be here today, but Hungry Lambs. So the monthly food bank. So we visited as a core team, to see what percentage of participants were obtaining fresh fruits and vegetables. So at our first experience, I think there were around 250 cars. I don't know how many families were represented at that food bank. It was a very busy December food bank. And the first, it was just 10%. It was the first several cars that obtained the fresh fruits and vegetables. And then no one after that got the fruits and vegetables. And I wouldn't even say that they were fresh because it was December. So we started to identify what are the challenges for that. And of course, it's the growing season. So Hungry Lambs expressed, we have raised beds and we're working with Fresh Start to produce these, but we just don't have the growing season. So we need a greenhouse. So collectively, Wild and Wonderful, again, we just brought together our resources and applied for a grant collaboratively to get them a greenhouse. So it is actually in construction right now. So we hope to see, that percentage just continue to grow as the greenhouse is erected and the growing season is expanded for providing those fruits and vegetables to, at first, the food bank, and then expanding to the community at large.
Where's the greenhouse going to be built?
It is being constructed now on the side of the resource center, the Logan County Resource Center.
Great, thanks, Kristen. Michael, Karen, do you have any examples or illustrations you want to share?
I would say from a personal perspective, so I have been involved in various meetings at the county level where the consensus to get behind one particular project was a little bit more difficult. And then because of that, you found some people found themselves no longer being part of the discussion. And then that halts any kind of progress. So I think that's one area that I can personally contribute. Is not so much from an organizational standpoint, but just something that I have observed as I have been involved on a scale of attempting some of these wider opportunities. One thing that I have found through specifically where we were, Kristen brought up the healthy foods, fruits and vegetables, and the growing season and different challenges there. As we have continued to work with it's pharmacy, but it's FARM, so pharmacy, which was a collaboration through WVU Extension Service, and the Walmart Foundation had provided some grant funds for a couple of years, and we were the healthcare arm in the Lincoln County to work with this program. And what we found, there was a higher success rate of participants when we called the night before to remind, hey, just want to remind you, because it was it's 15-week program weekly. And there was enthusiasm, but it was on a small scale of who we were able to help. And so some of the challenges that in moving that program forward, which is, this will be the third year, but the support systems are a little different, and it's more the organizations taking on more of the distribution and administrative side of things. One thing that has become a challenge for my coworker who is heavily involved in that program is what's going to be available and from where. So the aggregate turn row, right, was able to provide a lot of support. The hope and the intent was it would get more down into the county opportunity to provide that farmers market arm, but the resources in the county just aren't there, or the supply chain just isn't there as it may have been 20 years ago. So I love listening to Kristen and Michael talk about, the various programs to try to get involved in the actual agriculture spot of it. Whether it's the greenhouse or the vertical farms that I'm seeing a lot of. Wyoming is doing a big thing with vertical farms and some success stories. We may have to start looking at those types of opportunities to get involved with, because between supply chain and distribution, it's just not where it once was.
I have a really fun thing that just happened yesterday at our end of the year family night at Mann Middle and Mann Elementary. My county director and my site coordinator there, Tasha Gibson, Lisa Hill, had this idea of, what if we could have a mini farmers market there? And the idea grew, and there was a couple of vendors. Some people donated some stuff, but I said, look, between we have partners in prevention funding, we've got funding, we've got general donations. I said, we'll let every kid, the kid do it, but the parents are there. So they're seeing their kids getting excited about this, buy $15 worth of vegetables. So there are 50 kids there. So for $750, we made the idea of going through and picking your fresh vegetables. And the vendor got so excited about this, he made a connection with somebody coming up, I think from South Carolina. So every kid could have like one of these smaller than soccer ball size watermelons. So we had all these kids like balancing watermelon on their heads, and they had their bags of other veggies. And, I don't know about you, but my Facebook pages, there are always people from your community that go down and drive 4 hours and bring back peaches or bring back that. Those folks could come to places the families were already gathering. And hopefully that first of all makes them think about, well, maybe I should stop at that roadside vendor. But if the vendors know that they've got a set audience, a set customer clientele, they'll come to events like this because they know they'll sell out. I mean, it would take a long time to sell $750 worth of vegetables on the roadside, but they were there for an hour and a half, and they made a good, they made a good deal, and families got all these fresh things that are so much better in the food desert of the kind of, the veggies at Walmart are grim, and they got all this good fresh stuff.
They do. Then the issue is sustainability, right? So we've got a great event that happened, and 52 weeks out of the year times infinity to keep it going. And I think that's where the conversation at some point has to go.
Yeah. I think if people got excited about it, we could find the vendors that would do this on a monthly basis if they knew the customers were going there. And that's the thing, is to generate enough of the buzz. And this is, yes, it's a little bit more expensive than I get quality, and comparing that to income to community money, I ways again, but it's a slow build.
Mhm.
It is. I completely agree, Michael. I think it's a slow build. And I also think that people have to reimagine kind of the breadth or scope of what it is that they do and their priorities. So I'm going to guess with Kristen's group, part of the success is even though an organization may have priorities, they still participate, even if the group has decided that their organization's priority isn't what the group's priority is, but they're still participating in the project. Yeah. Okay, let's move into kind of the crux of the conversation today, the concept of the collaborative conduit. As discussed during last year's Health and Hunger Summit, we described this as a personal organization that centralized and shared relevant information between systems and organizations to harmonize efforts, eliminate the duplication of programs and services, and cross-promote one another's services or upcoming events. What are your thoughts on this kind of concept?
Right. So again, just my initial remarks is, we were working in silos, and it's the model that we're running, could be implemented by any county. And I know Sharon Lansdale is working hard to get that expanded across West Virginia, but it essentially addresses all of these things that you just said. So we want to eliminate the duplication of programs and cross promote those events. And it's really just, it really builds that collaborative conduit you're talking about. It just builds the framework for a community or a county or a region to be able to function just harmonious with one another.
Karen, do you have?
Yeah, I think that the conduit, absolutely. I would in full support of centralized information, and then maybe potentially taking it a step further and looking at how you also break it down in terms of the family that has a toddler or or a couple of toddlers that haven't made it into the school system yet. That channel of communication to them may be different than the grand family or the senior citizen who doesn't have a family support system. So when you talk about a conduit, I think you also have to look at it. Would it make sense if you have the centralized location to have people who specialize in the channel of the communication to specific groups, because they learn or they're exposed to where to get information a little bit differently?
One of the things that we happily embraced doing during the pandemic is breaking down the siloization of age levels of families. You mentioned early toddlers versus, grandparents taking care of teenagers. And a main part of our funding is after school funding, and you can only work K through 12. You can't even do pre-K kids if they're at the school. But we scraped together, and we had COVID relief money, and Office of Child Nutrition is my very, very favorite agency in any state government I've ever. They're wonderful. They will do anything bending over backwards to make sure you can feed kids. So during the pandemic, we had a range of kind of flexible funding, and we just pushed, that's why we applied for these family support center grants. We realized we had to diversify our funding if we were going to really be able to open to serve families, whatever age their kids are, and whatever multiple ages within a particular family. So that's just a response to your thing about that. I think trying to cultivate both. You have to have some people with some specialties and expertise, and they're early childhood experts, or they're mentoring at-risk teen experts. But you also have to figure out whether it's a volunteer. We have to figure out whether it's a volunteer basis. We have worked really, really hard to raise enough money to have a full-time benefited employee in each of the major communities. So we have 3 area coordinators in the 3 parts of Logan County. We have a full-time person at Big Ugly. We have full-time people in 2 or 3 different sections up there. And they're that continuity. They're the ones that tie in with all the other individual programs, so they know how to get resources. And we're also trying to give them enough time that they can connect with other agencies. And so if there's somebody that knows who you called, not just giving 211, and the benefits, we have retirement and we have full health insurance. Having people be able to afford to stay with you for a long, long time is huge, because I'm on more meetings with people that they said they have all new people who are their outreach workers in this particular county. Cultivating somebody very local, challenging when people say you have to have a degree. Well, if somebody's been doing community work for 10 years, you might want them to have an associate's and not a 4-year degree, because they'll bring so much to the table. Obviously not, not as a healthcare provider, but an awful lot of what we're talking about here is kind of lay health ambassadors or lay educators. And there has to be some sort of system to break down some of the professionalism that keeps the local folks that love their communities and be there year in, year out. And that's the kind of conduit I try and support. Not that I'm, again, I have a bunch of degrees, not that I'm against people being passionate about West Virginia who've got degrees, but frankly, I'll trade somebody like me for somebody who grew up on Big Ugly and, knows this is what they want to do for the rest of their life.
I think you made some really important points, Michael. One of them is, years ago when I started doing health advocacy work, there would be one person in a county who I knew everybody. And so if I wanted to go do a project there, I would call them and I would get a lay of the land, right? Here's who you have to talk to. Here's where some issues may lie. And those people just don't seem to be around. It's like we're not trying to cultivate people in those roles to stay there. So, there's a real nuance, there's a real, historic knowledge that is so important in doing that community work that we lose the more we have people turning over. And so if we had people who played those roles of that collaborative conduit in communities, one of the most important things I think would have to be that there be some incentive for them to stay in that role.
The other piece, and I love the concept of apprenticeship, and I came to West Virginia as a 20-year-old, wide-eyed, wow, this is the first time I've lived in a rural area, loving being up in the hollers. But I very consciously found community elders, who are the folks who knew everything about the community. And I had the concept, I'm apprenticing myself to this person to learn all these incredible things they know, but also to get a sense of what it is to live in this place. And I think making sure that all of our new staff have time to just go out and, to listen. Every housing project development and every holler still has the Aunt Sally that kind of has her finger on if there's a fire, how to make sure that the family who got burnt out gets taken care of. And as we bring in new staff, whether from the inside or the outside, making sure people have that time. I wish when I was not as busy as I am, I used to try and have one of those conversations once a week. New frontline staff, just to make sure that they have some time to hear what it's really like from the community perspective, and not the very narrow reason somebody's coming into one of our agencies. I think we can build that into people's time, and it also will keep them from burning out, because it's one of the most life-giving, refreshing. I've learned more about life from doing that. And it's part of what has sustained me in doing this stuff for the last 40 years.
That's a good point. Before I move on, anybody have anything they want to add? Okay, well, so we've talked about the theoretical benefits. So do you think it's feasible and to kind of fund and create these folks or organizations to serve as a conduit? And I'll just mention, we kind of came up with this idea during last year's series, and it was Mark Linville, who at the time was at Boone Memorial Hospital, who was working on his presentation. And, he was an administrative person at the hospital, and he called me and said, nobody's in charge of any of this. Like, who in this community, I don't know I know that we do food drives, and I don't know where that food goes. And, I know there are pantries in town, and who are we supposed to find at our hospital to be that that person who's going to know where all the pantries are? And so, there's a real need to have this kind of connection between these organizations. But at the end of the day, is it a feasible, idea? How is it fundable? Where would this person be housed? Do you think that it's a feasible thing, and what would the challenges be?
So we're hoping that it's a feasible thing, because with an 8-hour, being one of the core team members and being part of the larger mission, I said, okay, I have a nurse practitioner. She's very involved in the community. She loves community education. So we devoted, or kind of granted her, for 8 hours a week to kind of push forward the initiatives Wild, Wonderful, and Healthy. Because it's like, we had a lot of great ideas, but it did take a lot of, boots on the ground. We needed some work. So for the last year, she has been acting in that capacity as community education coordinator for 8 hours a week. And we saw the great things that can happen with just 8 hours a week. So together collectively, we are getting ready to hire a community health improvement planning coordinator. And that person will be hopefully sustainable. And we thought about different ways we could do that. So we have everyone at the table and everyone's invested. So we kind of first looked at, would this employee be just a timeshare? Of course they have to fall under one of the core group as far as, employee, but they're truly a timeshare as far as, funding to help push our initiatives forward. And so collectively, we have been able to really put together some resources, some grants, and brought different people to the table that have, and we continue to look at just the economic advantage of healthy population in Logan County. So there's a lot of investment from the economic perspective also, that we have to create a healthier workforce. So we are getting ready to post the job, and it is a full-time position. And we hope that, that is that person that does all of those things that you just said. And they're truly the liaison between all organizations in Logan County. And, and we continue to speak on a county level, because I feel like as soon as you hit that county line of Lincoln or Mexico, that's where our expertise stops. And that's where we don't have the connections and we don't know the people. And so we tend to work in that silo of county, specifically of Logan County. But we are very hopeful that this person will really excel our program and excel our health statistics.
Well, that's very exciting. I'd love to hear more next year about how it's going.
So is the question from a exploration of outside of your own organization, what do you think the challenge might be for that type of coordinated position and effort to be created, whether it's on the state level, county level, or is it more internal from the organization's perspective?
So what I mean is more, broadly, like she said, I completely agree with Kristen that there's kind of very stringent county lines, right? So we kind of collaborate within a county, sometimes even just a community, as Michael had said earlier. And so it would, if you wanted that person to have the role at your organization, but then that person would need to collaborate with the other organizations in more of a, larger concept. I've heard people say before that it's a role that we already have with the Family Resource Network, for example. And in some ways we do, in some ways we don't, because those folks already have so much on their plate. The notion that one person could do all of the collaboration and, stay on top of the happenings and sharing information would just be too much on them. And so, but that doesn't mean that there couldn't be a similar network funded by the state to ensure that there are people, in each county. And then it could be similar to organizations applying to have that person housed in their organization, and the state give that money to that organization.
Okay, so I think that there may be, this would just be my 2 cents. I like what Michael had been saying just a little bit ago about the apprenticeship and getting into the communities and finding a way to create a pathway so that the person wants to continue along and keep doing that type of work. Because once you train somebody up and 2 years they leave you, they just took every bit of effort that got poured in, and that knowledge base may not have trickled down into the training of the next person if the next person came on board within that 2-week period, which I don't know how you all feel, but that never seems to happen whenever I'm in a hiring process. You're months away and the knowledge just left, and you've got what you can to contribute to training them up, but they've got to almost start all over again. So if there was a way to create something, maybe even it begins on the high school level, maybe it's a opportunity to compete for a particular scholarship for a community college background in business that served as your maybe X amount of community hours were doing something in that apprenticeship, but then you're almost in it from a perspective of I get to see what it would be like. Then I get some opportunity to pursue a college or some type of training, even certificate wise for it. Then for 2 years, I work with the state position, and then in these counties, 5 organizations have agreed that here's what we'll contribute after that 3-year or 5-year period to keep that position going. I don't know, it's almost like a stair step approach, but everybody has to somewhat contribute something so that at the end of the day, you maybe have retained that person for a 10-year period, but constantly growing and learning and improving to get to a opportunity where they may then, Kristen's position that they have identified that they can absorb as an organization. Maybe all of this training is what they then use to be the person that they hire X amount of years later into that position that they know is sustainable for their organization.
I really like what you were saying, Karen, about the kind of stair step approach. A couple of, try and keep these quick. Trying to identify community leaders very, very early on. And in my field, I like to say I look for people who look after other people's kids in addition to their own at a picnic or a fair. So the kid who's getting into trouble, somebody kind of rails them back in if their parents are not there or vacant. And then on up, I think national service has tremendous potential. And again, that's a high turnover kind of position. But instead of approaching it as 1 year after college or during college, using that as part of a long-term leadership development within the community. We've had VISTA since 1995 and have had as many as 20 VISTA at a time through a grant that we have from the feds. And we've gone from being 50-50 with people coming in from the outside to 95% of our national service members, our local community members, were investing in their skill development and the hopes that they might become future employees or go on to become back. We have like 8 people that started as after school instructors that went back to school and are now in teachers in the Logan County schools. So I think you can grow leadership, but you start early. $250 stipends for 14 and 15-year-olds. In Charleston, we've been able to do jobs programs because the city has some money. Well, let's try and see if regional funders will allow that. But I think we can grow folks that way. And I love the idea of multiple agencies pairing together to have one of these positions, because most small nonprofits can't afford it all by themselves. But that kind of liaison. And then the last thing is Partners in Prevention through Team for West Virginia's Children, one of the best agencies in the state, is piloting a program called Lean on Me, which we ought to be able to claim the ownership of that, since that's Bill Withers' song, and he's a West Virginia man. But in Arizona, a very valuable model of doing focus groups about how you can provide community peer support to help each other find services and resources. And they're piloting focus groups the next 2 weeks. Step by Step is one of 5 groups that's doing that. But from that, they hope to come up with ideas about how you can take that concept of community peer support and build on it. And that would be a perfect thing to partner with the idea of there being a multi-agency community liaison.
I love these ideas. I love the idea Barbara put in the chat that Ohio County's Family Resource Network is an excellent form of communication. I think that, partnering with the Family Resource Network, prevention partners in prevention, this person kind of having an apprenticeship with this already existing network and building from there. And, we're talking about it during our next session next week, but the importance of building that sense of community for our young people and then giving them, imparting this kind of wisdom from the folks who have been doing the job, I think is also a wonderful idea. And I'm so excited to kind of percolate on this for a while. I see that surprisingly, we have 4 minutes left. And so I just want to grab some final thoughts that you may have about the conversation that we just had, maybe things that we should think about but ran out of time, or ways that we can follow this thread as we continue to think about this idea of a network of collaborative conduits.
My thoughts, and probably one of the questions that we didn't get to, was just regarding really policymakers and the collaboration of that. And it's just really, I think our job in the healthcare sector, because we do work siloed, would be to continue to educate the other sectors in their role in just food insecurity and their role in health in general in the community, and your county commissions. And I think we have improvement to do in that area in educating those policymakers and really educating them on the social determinants and the other factors that play into health that maybe they're not privy to. But that would be kind of my closing remarks. Is just I think we all in the healthcare sector need to do a better job of getting that on board, and so we can implement policy and really health related policy, so we can make larger changes, more sustainable changes.
That's a great point. Thank you, Kristen. And I think that's one of the great things that your project is doing, is trying to make that case to local policymakers to see that connection between healthy community and economic development.
I would say for just a closing thought is all of us who are in West Virginia, we've built lives in West Virginia and we see children growing in West Virginia. We want to keep people here. We want to keep providing opportunities for them to be here and living their healthiest life with us. And I think that these types of conversations is what helps us to see that, we all might have an organizational goal and business model objectives, but at the end of the day, we are all in this together, because if we don't help our kids live their best lives and have opportunities to continue to do that, and then allow them to take over and then train who comes through, we're at a loss just statewide of keeping what we need, which is our people, and giving them the opportunities that they need to thrive.
Thanks, Karen. Michael, you want the last word?
Well, you should come in after me, but I like us to think about how to act locally, schmooze regionally, and witness globally.
Ooh.
And act locally is very, very, very local opportunities. The apprenticeship model, the stipends model, young people, parents whose kids are a certain age, they feel like they can go back and volunteer more in their community, creating lots of structures for both opportunities to serve and affirmation of what they're doing. And national service can be a huge part of that. People do not make enough use of national service opportunities. The schmooze piece is what we're doing right now, but maybe particularly, even though we're kind of very county centric, on Big Ugly and Hearts, we have to relate to Danville and Boone County, and we have to relate to Chapmanville and Logan County, because we're much closer to them than we are to the county seat. So I think challenging that things can only be county centric, but not huge regional things but sharing the best of what we're doing. And then the witness thing, I think, Kelly, you're doing a great job of that with Think Kids, is you're holding up the best practices and both the power decision makers and funders, and also so people, if there's a great idea in Martinsburg, I want to steal it as much as I want to steal something from Mingo County and McDowell County, even though their circumstances are much closer to what we have in Lincoln and Logan.
Great point. And with that, we are out of time for today's session. Many thanks to panelists, the Palatine Foundation of Huntington, our attendees, for this really great informative conversation. I'm really kind of excited to write it up, which all of this will be, included in our final issue brief at the end of the year that we'll be sharing with legislators. The video from today's discussion will be posted on YouTube tomorrow. So be sure to share with friends and colleagues who care about this issue. If they have anything to add, please contact Think Kids. We'll include it in the write-up and the dialogue. And we hope to see you on social media to keep this conversation going, and hope to see you again next Thursday, where we'll discuss better youth engagement and how that can build a better food resource network. And it seems like we've really kind of patterned the way for that next discussion. So again, thank you so much, panelists and attendees, and hope to see you next week.